Ireland's vaccination programme against COVID-19 has been designed to ensure that those who are most vulnerable to the disease are the first to be protected. This, alongside the vaccination of healthcare workers, is to be welcomed. On the 24th of January, the HSE completed rollout of the first vaccine dose to the majority of residents and staff in nursing homes. Administration of the second vaccine dose is nearing completion. Those who are unable to receive the vaccine due to their COVID status will be included once it is safe to do so. Vaccinations in residential congregated settings that were not included in the first series of the vaccine programme, such as unregistered voluntary and religious order service providers, has commenced this week. First doses have been completed in congregated disability and mental health settings for the over 65s. The vaccination programme has already served to be sufficiently adaptable in responding to delivery shortages and change. The vaccines that have been administered have undergone rigorous testing and review prior to their receiving conditional market authorisation from the European Commission. These measures ensure that the vaccines that are currently being administered to the most vulnerable of our citizens, as well as those that care for them, are both safe and effective. The expert views of the National Immunisation Advisory Committee in relation to which vaccines, AstraZeneca's or the two mRNA vaccines, should be administered to older people is in line with this core principle of protecting those who are most vulnerable. Subject to ensuring availability of a second dose of vaccine for all those to whom they are currently being administered, Ireland's strategy is to distribute all of the vaccines that we receive. The only limitation to the vaccine programme is the supply of vaccines. The initial vaccine rollout is focused on vaccinating those in the highest priority groups, so those that are at greatest risk of serious adverse consequences from COVID-19 are protected from it. The strategy is underpinned by ethical principles with a strong focus on equitable access and prioritising those most in need. As the Minister of State charged with responsibility for older people, I welcome that the vaccine allocation strategy prioritises those over the age of 65 living in long-term residential care facilities, frontline healthcare workers who are in direct patient contact, and those aged 70 and over. The HSE, in conjunction with immunisation experts, is evaluating the further stratification and sequencing of cohorts for vaccination. I am pleased to note that the HSE Disability Operations has recently briefed disability umbrella organisations on the vaccination of disability service staff. Disability services have continued to operate during the current restrictions, providing an essential service to individuals and their families. Vaccination of these important service providers will, in line with vaccination plans for frontline healthcare workers, commence in the coming weeks. Registration online for this cohort commenced on Tuesday, the 9th of February. I would encourage all staff to register as soon as possible. Frontline mental health workers will also be included in this vaccination plan for frontline healthcare workers. Specialist mental health services continue to operate and provide supports to children, young people and adults across the country, in line with public health guidance. The rollout of Ireland's largest ever vaccination programme, less than 1 year after COVID-19 was declared a public health emergency of international concern, is a huge achievement. The availability of 3 authorised vaccines within this timeframe and the promise of others on the way is unprecedented. I wish to acknowledge with thanks the efforts of all involved in bringing us to this important stage. The initial focus of the programme on those in the older age groups and healthcare workers highlights our commitment to a fair and equitable distribution of vaccines. As more vaccines become available, we will continue to ensure that they are distributed fairly and to those most in need, until sufficient vaccines become available for everyone who wants to receive the vaccine. Gaurav Mahagut.